President and CEO of Hope Communities. Thank you so much for joining us today for our Building Community Check-In. I do have a guest that I'll be introducing in a little bit, Heidi Whitney from Mental Health Center of Denver. But for right now, I will talk a little bit about news and give you a couple of quotes. So this episode I'm going to call Mental Health and Wellness for getting through the pandemic. And we just know there's so many stressors out there right now. People are constantly bombarded with new things that they have to do. They have to adjust in new ways, and it's just stressful. Change is stressful. And so, I think it's wearing on us, and anytime that we can provide extra information for you to help you get through this, it's a pleasure for us to do that. We have been hosting these shows for about 15 weeks, I think, or so, and trying to provide up-to-date information about the virus, trying to give you information that will help with wellness and mental health wellness, help you to maybe have some activities to engage your kids so that they are being successful, and also perhaps give you some inspiration. So we know that some people watch these shows way after the fact, so if you see something today that Heidi says or that I said that you think would be beneficial, please forward the link to your colleagues. And if you or any of your friends have some questions or need some help with resources, you can check out our website, which is hopecommunities.org, or send us an email at info@hopecommunities.org, and we'd be really happy to respond and help you out. So here's a little bit of news. While it's not directly related to the pandemic, we want to really share our condolences and our best wishes for anybody who's dealing with the wildfires right now, whether you're there directly and your house or your property is in danger, or if you're just experiencing the smoke like most of us are now. I know it's difficult, but hang in there. Also, in Boulder County, and we probably don't need to really think about other things that are happening right now, but there are mosquitoes in Boulder County that have been tested positive for West Nile virus. So you need to be on the watch out for that, to try to wear some kind of mosquito spray or something like that to be preventive and stay out of certain places. The transmission of the virus to humans is from specific infected mosquitoes, and while most of the time it's mild, sometimes it could be pretty serious. And so you could have loss of vision, there could be inflammation, lots of different symptoms that include skin rashes, swollen lymph nodes, fatigue, headache, and body aches, which don't they sound a little bit similar to COVID-19? So just really be careful about being out there in places that might have a lot of mosquitoes. Also, college students are going back to school and moving into dorms, and for anyone who has kids that age, just remember they have to wear masks indoors and outside too if social distance can be maintained. So make sure that they're paying attention to those. We definitely want everyone to be safe, and we know that people in that age group have had a high rate of the disease and positive cases for the disease. So we want them to be careful, because we know it's going to be hard to stay away from their friends while they're in their dorm room, but that's what parents are for. We need to nag them and to remind them. So I have one of those, I know. So here's a quote for today. Good things will come to you when good things come from you. You will attract what you are. The goodness of this world is offered to those who are doing good for this world. And when you radiate positive energy, you attract more of the same. That's by Bex King. So we know that people need that positive energy right now, because some people are feeling depleted, and it's just been tough for quite a long time. So the more positivity we can express, I think, the better for all of us. We are also being asked to restrict our movements and to accommodate all these ramifications of the virus, and many people don't have solid incomes right now, so there's lots of stress there. This is going to lead me to another quote that is referring to people who might feel frustrated or short-tempered. When they go low, we go high. Going high doesn't mean you don't feel the hurt or you're not entitled to an emotion. It means your response has to reflect the solution. That's by Michelle Obama. I just think right now, if people are stressed and if they're quick-tempered and they retort in a way that is not really positive, if you can remember, and I remind myself of this quite frequently, if someone is going low, even if it's unintentional, to try to go high. So we can help each other out that way. So now we're going to turn our attention to Heidi Whitney, who I am sure is well aware of the frustrations and the angst that people are feeling. Heidi is a licensed social worker, and she's a program manager at Mental Health Center of Denver. And she works a lot in early childhood mental health consultation. I had the pleasure of working with Heidi when I was at Warren Village, and know firsthand what a talented social worker she is. But thanks for being with us today, and if you want to say a few more words about your job, that would be great.
Yeah, thank you so much for having me. So I am Heidi Whitney, and I am the manager of the Early Childhood Mental Health Consultation team. And so our team goes out to early childhood preschools and childcare centers, and we are there to support the staff and the families and the children there. And I've worked for the Mental Health Center of Denver for about 12 years, so yeah.
Yeah, and you were in the Learning Center at Warren Village, which was incredibly wonderful.
Yes, and it was wonderful for me. It was a wonderful experience to be there.
Great. Well, we know people, as I said, are really stressed at this time. And there's lots of fears around contracting the illness, and again, and having all of these restrictions and changes to work and changes to school. And I'm just wondering, people may not know the full scope of all the services that you provide at Mental Health Center of Denver, and I am sure that they can be so beneficial to our audience out there. Could you explain a little bit about those? I know it's going to be hard because there's so many. But whatever you can tell us would be great.
Yeah, no, it's a great point because Mental Health Center of Denver provides behavioral health services really across the lifespan. And we do that through a mix of outpatient programs that are clinic-based programs, community-based programs like the consultation team where we're out in the community, and then we also have residential programs, and we really do work with individuals and families really from prenatal to end of life. So we do have quite a variety of programs.
Wow, and you are all over Denver.
Yes.
I mean, the suburbs, everything, all around.
Yes, yeah.
Where are your residential facilities?
Well, we have a number of those as well. Some that are not far from here, but one that you may have heard of recently is Sanderson Apartments, which is southwest Denver on Federal. So also, even those programs have quite a diversity in who they serve and what their purpose is as well. Yeah.
And so for this purpose, residential really means having housing available with support services involved. So mental health support services versus a short-term residential treatment center for like someone who has substance use.
Right.
Yeah.
Right.
Okay.
Yeah.
Great.
Yeah.
Great. So where would somebody find like the whole list of types of services that you offer and how to get the help?
Yeah, so a great place to check out would be our website, and that is MCHD.org. And there you can see the programs that we offer, but also the locations as well. I think of some of our kind of main hubs that people come across or see as they drive as our recovery center, which is at 12th and Claremont. And then the office where I work at is the Dahlia campus for health and well-being, which is 34th and Eudora. And then I also always really like to point out the walk-in center, which is at Colfax and Claremont, so on the east side of Colorado. Because there are walk-in centers statewide. It's part of a statewide network. And you can find out about those locations and those services at coloradocrisisservices.org. And when you look that up, you can see that you can call in to the walk-in center, and you can even text as well. So I think that's really helpful for people to know.
Trying to make it as easy as possible.
Very accessible, and I think even when you talk about something like a crisis center or a walk-in center, people are unsure. You know, if they have a family member who's having a crisis or overwhelmed or stressed, people aren't always sure, is this the place to go? Is this appropriate?
Right.
And I think it's important to know that you can call and text and find out more. You know, if you wanted to ask some questions or talk through it before you go there.
Yeah, and if you've never, I mean, some people through the pandemic are experiencing stress and mental health issues that they've never felt before. And if you don't know even what you need to bring to a walk-in center or a rehabilitation center, you need to reach out to somebody.
Yeah, or what it'll be like.
Guidance.
Yeah.
Well, the Dahlia Center is right next to one of our properties, the gardens, and it's very, very cool because it's so much more than a clinic. I mean, it's a holistic type of a program. And you want to explain that just a second, and then if you have other programs like that in town?
Yeah, I mean, that is really a program that was shaped by the community and what they wanted to be included there. There is a preschool on site. There is one of our day treatment school that's on site. There's a dental clinic and farms and gardens, and a teaching kitchen, which is wonderful. And so there's a fish farm. There's a lot going on there, which is really exciting, and you know, I think a site that really brings in community engagement, which is so important. That can really be a part of the community in a different way.
Personal and community wellness.
Yeah.
It's a great pilot program. So
yeah.
Hopefully more will come up.
Yes. Yeah.
And so how has Mental Health Center of Denver been readjusting your work during the pandemic?
Yeah, I think we really made a quick shift to remote work, which I think has been challenging for everyone. And that's not just helping staff work remotely, but that's also ensuring that the people that we serve can access the services that they need. And so I'll just add that I think what goes with that is, helping people get connected to the resources so that they can access internet and devices and just helping people use a platform. I think that's so much of what we've all been learning and struggling to learn is how to use a platform to get your services.
Yeah, and even if you used a smartphone and you use different apps, the apps you have to use now are not necessarily the same. So it seems like just about everybody's on a steep learning curve.
Yeah, and our services continue to evolve. We had a number of services that needed to stay in person and then we continue to evolve programs to meet the needs of the community and really to ensure that the services we're offering work the way we're doing them. And so I think now there are some programs where it's a mix of telehealth and in-person. And I think those things will continue to evolve.
And you were mentioning just before we started this about your kiosks, which is kind of that in-between intervention. Can you explain that a little bit?
Yeah, I was saying that as we transition to telehealth and that remote work, we're also needing to be creative and learn more about what just individuals need. And for some people, they want to do that telehealth, they need to do that telehealth, but they actually need to do it not in their home. And so we've set up kiosks at a couple of locations, and it sounds like we're going to be expanding that so that a person could come in, sit at a computer, have their session. Sometimes that's because of where you live and you may have family at home and that maybe doesn't feel like a confidential space. Sometimes that's because of internet access and the difficulty with maintaining video over the internet.
And so it's pretty private at the kiosk. Where are those kiosks?
Yeah, so right now they are at the Recovery Center, and our North Federal location just started that as well, and that's over at Federal and Colfax.
Okay.
Yeah, So, when people call to start services, to get an appointment, they do need to know that it will start via telehealth, that they will be supported to use the platform, have ensure that they have an email address, um, make sure that they can navigate that comfortably before they really get into services, that there's support for them, but they should know that those services will start via telehealth.
Okay, and how does one become a client of Mental Health Center of Denver? And
Yeah.
even if you've never been a client before, you could start right now, right?
Yes.
Okay.
Yeah. And I was just having a conversation with my team and another manager about, we do realize that some people have kind of felt like, well, maybe I'll put off accessing services because they're not in person right away. And I think that's understandable that people are unsure of like, what will telehealth be like, and will it really fit my needs, or will it feel good? And yes, we're really encouraging people to still call in and start services. And the way to do that is to call our access line, which is 303-504-7900. And that information is on the website, and I think pretty easy to find on the website. But they would call in and talk through with an access clinician what their concerns are, what their needs are, what their insurance is as well, whether they have insurance or not, and talk through that, and then get set up for their initial services.
And I was just going to ask you if somebody who didn't have insurance could still get service.
Yes, yeah. Yeah, and we work with almost all of the private insurances as well, but it's always good to be prepared to talk about what is your insurance. Some private insurance has kind of unique requirements or circumstances around what they're paying for.
Yeah, so definitely have your insurance card there that usually has information on the front and the back that you can access.
Yeah.
Good. Well, I know this is kind of a big question, but because so many people are experiencing a lot of stress about mostly being stuck at home and what to do with kids, do you have some general tips for us for mental health wellness?
Yeah, I mean, I kind of think about both the conversations we have with families, that, especially for my team, teachers, but also just ourselves as a team. And the things I really think about are routines. The pandemic really disrupted the things that we could count on daily. And I think we continue to move through changes, like you were saying, like things change, there's a lot of uncertainty, and so I really encourage people to think about routines, especially if you are caring for other people and children. What are ways we can put a little predictability into our day? And sometimes that's having a really easy morning routine of breakfast and then something, or evening routines as well that help us cope, that help us calm in the midst of a lot of stress. And definitely if you have young people in your home, is letting them know, what are we doing today? What are we doing next? So that they have some predictability as well.
Yeah, and have you been seeing an increase in hearing about an increase in symptoms of depression with kids because they're missing their social interaction and so forth?
Yeah, and I think there's a number of different things coming up. There can be more stressful things happening in the community, more stress in a family because of basic needs. And then I think there's other things too. Like I said, there can be a lack of predictability in our day that makes kids feel anxious. And so, yes, symptoms in general, yes, for sure.
Yeah. People are in the house more, so they're crowded more. One of the things that we talked about during one of our shows was just the fact that historically, sometimes when people are under these kind of pressures, like not having enough basic needs, not having enough food, being crowded together, being a little bit depressed, sometimes there's more opportunity for abuse. And so, taking some of these really strategic steps to improve the wellness of your household is really important.
Yeah, and I know that like self-care can really be a buzzword. And I think of self-care as also thinking through the things that help you manage your feelings. And especially if you are someone who is caring for other people, caring for children, is thinking about what are things, small things that we can do that help us manage our big feelings, that help us calm and soothe, because we don't want to add a lot more to people's plates. People have a lot on their plate, but I think for some people that might be taking a step outside and taking a deep breath. For some people it might be going for a walk. For some people it's doing something active. And thinking about your basic physical needs of making sure you're eating regular meals, of drinking water. Yeah.
Especially when it's 95 degrees.
Yeah, really thinking about taking care of your body, which will really support your well-being and your mental health.
I mean, it sounds so simple and yet it's so essential to have that holistic viewpoint in your mental health, your physical health, just all the things that tie into well-being. So are there any other things that you're noticing that maybe we should be aware of, or any other tips that come to mind?
Yeah, I mean, I think we're going to share in the notes. The team that I'm on has created a Padlet, which is a platform where we can house numerous resources. And I'll just say that what we put on there, articles that may be helpful to parents during this time. Also, ways for families to talk about what we're going through, because we've also had a lot of numerous big things happen in our world, not just the pandemic, and being able to talk about those things to kids who are worried is important. So we've tried to put resources on there that can be helpful to families. We also have put on there a number of ideas of things you can do in your home that don't require a lot of materials or resources, things you can do with kids, videos that you can do that encourage movement in your home, things like that we hope are realistic for families.
Energize together.
Yeah.
So,
Exactly.
and for people, I did not even know this, so for people who have not looked at a Padlet before, the link that we're putting in the chat box will actually take you to a website. And so there are little boxes that have different types of information, either an article or an activity in there, and they're by topic area that relate to, in this case, to young children, and families, how to deal with different situations for young children and families. I hope you check it out, because it was really, really a cool resource.
Yeah, and if you go to the right end of it, there's a column where the resources are in Spanish as well.
Okay, great.
Yeah.
So at this point, you have Spanish interpretation, but other languages available?
Yes, so we have many clinicians at MHCD that are bilingual, that speak Spanish, and then for other languages we're using interpretation.
Yeah. Okay. So language should not be a barrier to getting your mental health issues taken care of.
Yeah.
Are there other resources that are on your web page that people should be aware of?
Yeah, so when you go to mhcd.org, there's kind of like a green banner at the top. I think a lot of websites have that now, that kind of let you know what's going on right now.
Right.
But at our website, we have a link to our page of resources, and I would really encourage people to check that out, because we have a lot of great information for individuals and families. Again, how to talk to your kids about the pandemic. And then we have also a YouTube channel called Wellbeing Live, where there are a number of videos on different wellness and mental health topics. So I would definitely encourage people to check that out.
Great. We'll have to write that out in our chat section,
Wellbeing Live.
.org, or just Wellbeing Live?
Wellbeing Live on YouTube,
Okay. Great.
Yeah.
Awesome. Well, it's been so wonderful to to have you on the show.
Thank you for having me.
love hearing more about what you're doing. And Mental Health Center of Denver, has been an icon in this community in terms of mental health and general wellness, and you've been so innovative through not only this time but all times, and so it's really a great resource for our community.
Thank you so much. Thanks for having me.
Thank you. So, part of every Facebook Live show that we've had to date has been that we share a book review, and most of the books we try to make sure are downloadable from the Denver Public Library to make the greatest, easiest access for books. And this is the first show in 45 sessions where I don't have any book review. So I'm not going to do one today, but I'm going to ask if anybody would like to do a book review for us. We would love to have it. Email me at info@hopecommunities.org and let me know if you want to do one. We have lots of them on the website that you can check out. We're looking for a video of about 3 minutes, and it's a really great way to share nice, fun books or interesting books for people who want to expand their book list, because a lot more people are reading right now. So please let me know. I would love to be able to showcase your book review. So that is our show for today, and we will be back on Tuesday, where I hope you will join us. Please be well. Please make smart choices. Help your college kids to make smart choices, and we want you to stay healthy. Let us know if there's anything we can do for you by reaching out at info@hopecommunities.org. Have a great day. Bye. Thanks again, Heidi.